families are excited to help out and see if we can get another vaccine approved in kids.
It seems like the side effects are not as dangerous for the health that the side effects, not the side effects, but consequences of the COVID.
All Quebecers likely have one of these, a vaccination booklet from when they started getting immunized, starting at 2 months old. And now that researchers in Montreal are studying the efficacy and safety of a COVID-19 vaccine in children as of 6 months old, by next year, documenting babies' COVID-19 inoculations in this booklet may become a reality.
Everybody's working quickly to try and get the data that are required to be able to get approval for the vaccine, while still taking all the appropriate steps to ensure that it's safe and effective at this dose and in this age group.
The Vaccine Study Center of the McGill University Health Center in Montreal's Pierrefonds is one of 100 sites in North America studying Moderna's mRNA vaccine Spikevax for babies, toddlers, and young children, which is already approved for those 12 plus and currently being reviewed by Health Canada for those as of 6 years old.
What we're looking for is to see that the antibodies that are made in response to the vaccine are at least as high in kids in this age group receiving this dose as they were in adolescents and adults receiving the higher dose.
The teen and adult dose is 100 micrograms. For those 6 to 12, it's 50 micrograms. 6-month-olds to 6-year-olds will receive 25 micrograms of the same vaccine, which will be studied on 50 participants in Montreal and 12,000 across Canada and the U.S.
They get randomized to either receiving the vaccine or a placebo, and there's a 75% chance in this part of the study that a child would get the vaccines.
Although data for the trial may only be submitted in spring 2022, Montrealer Caroline Vouligny, who has a 7-month-old son, Edouard, is already on board with vaccinating her baby.
I'd rather get him the vaccine and let's say I did everything I could to protect him, then the other way around, like he gets the COVID, he gets hospitalized, and I'm thinking, oh no, I did not do my job as a parent to protect him.
COVID-19 certainly can be severe in young kids, albeit rarely. There's also a post-infectious complication, multi-systemic inflammatory syndrome in children, which is also dangerous. And so if given the opportunity to get a safe and effective vaccine, that option is probably worthwhile, even though kids are less commonly severely affected.
I'd rather be safe than sorry.
The sooner we stop transmission at a global level, the sooner we're going to be able to get back to normal.
In Montreal, Alyssia Rubertucci, City News.